recording.
No, that's great. Wanted to, I clicked, got it. Wanted to see if Representative Terrasas was able to be here yet. So it's going to give a few more, just a few more minutes to see who else might join. And if not, we'll just be on the lookout for him.
And John, thank you for extending the invite to so many, because I personally always find these gatherings quite informative. And even though the regions handle things a little differently, it's always useful to know in detail what the other regions are doing, and always continuous improvement across the board. So thanks again for extending the invite. And I'm hoping most of our team can join us today. As you know, they're still quite involved with all the COVID activities as they are statewide. So thank you for this.
Yeah, it's yeah. Every day is an adventure for sure.
No kidding.
Perfect. Yeah, I wanted to give it a few minutes, and just I don't want to get too far down the path of the meeting. I got an email this morning from Representative Terrasas, and he was gonna join us for a few minutes. So I wanted to give him a quick, little opportunity.
No one new waiting we have one, but I haven't seen Representative Terrasas in our waiting room. Slowing down a little bit.
Perfect. Perfect. Well, we'll just be on the lookout for him, and if you see him, Maureen, and I don't, I've got my comments up. If you'll just send me kind of a direct message, that will be awesome, and my thumbs up to go ahead and invite him. So I'm going to go ahead and get started. So for those of you that don't know me, my name is John Kutnak, and I am the Southwest Region Health Promotion Program Manager. And I've been with Department of Health for about almost 2 years, believe it or not. Time flies when you're having fun, and we're in the middle of a pandemic. So really hit the ground running, and it's been an exhausting, busy, right, last 2 years for all of us. And I wanted to kind of start off by acknowledging that, and acknowledging the work and the value that each and every one of you bring as members of the Health Council, supporting the valuable community health work in your communities. And we really aren't able to do this work without everybody collaborating and partnering and working together. And so today's meeting, I really wanted this meeting to be an opportunity to hear from our health councils, and really kind of piggyback on the excellent statewide meeting that our partners at the New Mexico Alliance of Health Councils hosted back in October. I think it's really important that we build on this momentum. I think it's really important that we share our stories, we share our challenges, we share the good work that we're doing, because we are really, still very much so in uncharted waters, so to speak, right? Uncertain times. Right now, it's kind of, I'll just say it, a little discouraging, right? To see our COVID numbers at the statewide level going up. We're still, we're seeing hospitalizations on the rise. We've got 6 hospitals across the state who are in, surge capacity. That's what I used to call it. I'm an old hospital administrator. So I think they've got new words for it now. So I just today, want to build on what you guys are doing, the work that you're doing, so we can learn from one another. And then there's a lot of exciting things happening, right? But with excitement comes change and comes anxiety, right? So there's lots of pieces of the puzzle to put together with the CDC Vaccine Equity Community Rebuild Grant. We've got, expansion of our community health worker network across the state. How do all these pieces of the puzzle fit together? So we're going to spend some time at the end kind of talking about that. Let's work together to put this all together. So, but before we get going, I am honored. I also, we extended some special invitations to leaders at our state, local, and county level, because I wanted this to be an opportunity as well for our leaders to learn about the health councils, the value that health councils bring to our communities and to our state. So without further ado, I'd like to introduce Representative Luis Terrazas, who represents District 39, and his area, congressional maps, gotta love it, right? Wide area, we've got a lot of land in New Mexico. So he covers Doña Grant, and Sierra counties. And he participated, if I recall correctly, he's dressed a little bit more formal today. He was on the beach at our last statewide meeting and took time out of his family vacation to talk to us all. And so take the floor, Representative Terrazas, and thank you for being here with us.
Well, sir, thank you very much for having me here. And I appreciate all those who are joining us today and all of our efforts in trying to always make health a better live a healthy environment or have a healthy environment and so forth, and working toward that goal. I appreciate you. Yes, this is normally how I dress. I'm an undertaker, so this is kind of my uniform, I guess. So I just came from a commissioners meeting that I had to speak to concerning Veterans Park that we're working on. And then, of course, I've got to head to the office. I've got a meeting here shortly. But I'm always working. I am on the, during the session, I am on the Health and Human Services Committee. And so I find it's important for us to work on that, and we can always do better. Quickly, as a funeral director, I do get, we're privileged to families sharing what is going on out there. And as far as healthcare and being a state legislator, I have people that come up to me and personally share their stories freely. I mean, I'll be at a meeting or so forth, and they'll pull me to the side afterward and share their stories. And so you're right. We have some challenges right now. Absolutely. We are seeing our numbers go up. And, I had a conversation this morning with Sharon. I said, the sad thing is, we have a lot of sometimes disinformation that stifles people in wanting to get vaccinated or why they stay away from it. And because we're people that we as a society like to have one answer that is going to be the right answer in what direction. And we're finding ourselves that there is no right, perfect answer. And because of that, it's causing, and then the disinformation from both sides sometimes gets kind of cloudy and causes people to struggle with their decisions. And and what I mean by that is I've had through the mortuary, I've had people that have been vaccinated and still end up getting infected, and then I have people that aren't vaccinated and get infected also, and causing them to pass away on both sides. And then you also have people that are unvaccinated and wouldn't even know that they would test positive. And then you have somebody that's vaccinated and could possibly get sick, and vice versa. It's just so strange. Um, I suffered through it probably, I don't know, 4 months ago or so. My wife and I, we totally had two different outcomes. I weathered it like nothing. Like I had a few allergies, and we quarantined ourselves in our home, in at one of our homes, and but my wife struggled a lot more than I did. So, and I think she's healthier than I am, and so it just makes us, it's unpredictable. But I think where I'm going to tell you the challenges that we also have is talking to my fellow funeral directors. One of them made a statement: "We're so busy in the mortuary," and he goes, "and it has nothing, and it's not necessarily COVID," he said. And I said, "Well, I think what's happening is maybe it's not because of the infection of COVID, but the decisions that have been made because of COVID and our pandemic response, in that we have a shortages of nurses, and we also have a delay of care in other necessary maintenance, I guess if you want to call it that, to our health. Just going to a doctor for normal things, whether it's a knee replacement or whatever, these elected surgeries. And so we're seeing kind of in some cases, we're seeing the lack of that care taking an effect and hurting our citizens and stuff. So I had a man that came up to me, and he's one of our prized, and I won't share his name, but he's a wonderful educator, and he got sick. And just to give you some of the stories that I'm hearing, went to the local hospital and sat out in his car for 9 hours to receive treatment because of lack of staff. And so things like that are scary, and they're stressful. And so, I'm hoping that during this pandemic, I think sometimes things get caught up in politics, and we have to get away from that and listen to one another and respect one another, and try to put all our ideas on the table so that we can actually come up with some good solutions. There's not going to be one perfect solution. And I want to share this last thing with you, because I want you guys to get going. But I think what is happening is as a society, or as a government, we've done our job in spreading the message of vaccination and mask wearing has sometimes caused the public to ostracize, or there's this tension. And so my son, who was a preemie and has lung issues, I was very stern with him to wear his mask last year. And from one year to the next, he lost a tremendous amount of lung capacity. And the doctor signed a letter that he no longer needs to wear one. But unfortunately, even though he carries his letter and so forth, sometimes he's looked at as, hey, you know what, you're just trying to not follow the rules. And the only reason I say that is there are people also that with vaccination issues, and and the mask issues. And by me saying this, I'm not saying we shouldn't do any of that. That's not what I'm saying. I'm just hoping that we as a society can come together and respect one another, not knowing each other's health. There's people that I know that can't that come in and are unable to wear a mask because of their health problems or what and whatnot. I guess where I'm trying to go with this is I hope that we all of us together come together, recognize our the issues that we're dealing with, and do it in a respectful, kind way in working with one another, and hope that we keep the political environment away from it and just do the best that we can for our citizens. And so I appreciate for you giving me the time. You know that I care so much about our state, and I am concerned with healthcare that we're dealing with right now, and the numbers that are going up, and so it's all of our responsibility to make our communities a better place and taking self-responsibility. But we appreciate you giving me the time, and I know I give you a very vague and kind of a quick synopsis of what I'm seeing, but I hope that I guess my main message is we do have some challenges, but I want to see all of us as a health council work in messaging where we all come together and respect one another, yet make the decisions necessary to hopefully bring more nurses back and more medical personnel back, and so that they can have a better healthcare system.
Thank you, Representative Terrazas. No, I think that's a good message, and it's good to hear the perspectives you're hearing out in the community. I don't know how long you'll be able to be with us today, but we've got Marilyn Alcorn and Evangeline Zamora, who are very active in the Grant County Health Council, and they've done some great work on messaging that you're going to be hearing out of the community, and I'm extremely proud of them. So I know this won't be the last time we meet, and I just again appreciate your interest and participation with our health councils. So thank you.
Absolutely. Thank you very much. And thank you for letting me be a part of this. I am going to take my camera off, and I'm going to mute myself, but I'm going to listen for at least a while. I've got a meeting in a few minutes, but I did want to be a part of that. And one of the things that I'm going to say is not just talking, it's listening. So I have to do a little bit of that. We seem to have always overlapping of these meetings, and sometimes I've got to just participate in a portion of one and start on another. Thank you so much, John, for having me here. And again, I'll be listening in for a little bit. I am interested in listening to what they have to say. Good friends of mine, by the way. Thank you, sir.
Thank you.
You bet.
So next, so we all sent out an agenda, but we know that really during a pandemic, there is no agenda, right? We just kind of we're healthcare folks, we're community health folks, so we shift on the fly. And I am really pleased that Roberto Martinez, who I think we all know as our fearless leader in this health equity journey that we're on together, is able to join us for a few minutes. And I wanted to give Roberto an opportunity to talk a little bit to this group. If you notice down later on the agenda, I have some time set aside, kind of putting it all together. There's all these pieces. I'm going to reference that probably 20 or 30 times today. Okay, so be patient with me. But really, in my mind, it's a puzzle. And how do we put this all together and work smarter and not harder? So without further ado, Roberto, the floor is yours, sir. Thank you for being here.
No, thank you, John, for inviting me. And Representative Terrazas, thank you so much for being here. This is really exciting, and your presence speaks volumes of the support that everybody is willing to give to health councils in our communities. So thank you so much for sure. And to Wendy, to John, Sharon, the regional health promotion manager from other regions that are working with health councils. Thank you so much for your work. Really, I just have a brief intervention, and I have one key message to share with all of you. We are all in this together, and by this I don't mean just like in a dream way, but as I'm speaking in the logistics field too as well. This is that like the New Mexico Alliance of Health Councils, who is helping coordinate quite a bit of the work of the training and the technical assistance that you will be receiving throughout these next 2 years. The Center for Health Innovation, CHI, as well, who's helping with other aspects of the logistics, as well for accessing resources for health councils, departments of health, and many divisions of Department of Health. It's not only the public health division where I'm housed as the interim health equity director, but also I see Ariane, who is here today representing OPA, another division from DOH, and many of us in DOH who are really committed to ensuring that we all can work together and that we can support the work that the New Mexico Alliance for Health Council is leading in coordination with, with all of the other resources that we have. So as we move forward with this work, I know that we are all just trying to adjust as to making sure that we can work together, that we cannot burden health councils with unnecessary asks, that we can make sure that we can support you, but also do not bog you down with like reports and just sometimes the processes that we all have to undergo to be able to show that we are doing some meaningful work in the communities. So as we are trying to do that, we are hoping that, and the New Mexico Alliance of Health Councils is doing that, leading a lot of the work. But I can assure you that all of us that I've mentioned and many others that I have not are trying to, in coordination with them, making sure that we can support the work. So when you think about the work that you're doing, think about it as you have this cloud of witnesses, this cloud of this team behind you that is really supporting you as well. So I just really wanted to share that brief thought and just thank you again for all the work that you are currently doing, and also thank you for all our partners and John for putting together this. I'm going to be listening here as well and for a while.
Thank you, Roberto, and safe travels. So next on the agenda, as we're kind of traveling down this journey, as we're trying to put this all together and then hear from you all, I want to turn it over. These meetings, I think it's really key, to work with our partners. And I couldn't do this. I know none of us really could do this work without the New Mexico Alliance of Health Councils. They are valuable partners in the work that we're doing across the state and in our communities. And they play a extremely valuable role. And so I noticed, we were punting late yesterday. Sharon, I can't split her in multiple pieces. So she had a meeting that came up, and so I'm gonna I saw that she was able to join, but between Wendy and Sharon, I'm gonna kick the can over to you guys and let you guys give your introduction, and then I look forward to turning it over to you guys, the health councils, to hear about what you guys are up to and what your challenges are and what great work you've been doing, and we can get ideas from one another. So Wendy, Sharon.
Thank you, John. I'm just going to share a little bit about why I was late, because it's exciting. And then Wendy is going to share a fact sheet that we prepared around this project that we think will help health councils. And so one of our goals has been to involve more tribal communities in the work of community health across the state, so that we can work in partnership in a more equitable way with tribal communities. And so this morning we were really excited to meet with the Lieutenant Governor from the Picayune Pueblo. And they are excited about becoming a part of the Alliance and working with us on the CDC project. They are newly forming a health board that will serve as their health council. And so Wendy prepared to step in my place, and I want to let her go ahead and present what she has to share with you. But thank you for recognizing our partnership, John, and it is a partnership, and we are truly grateful to have such great partners with CHI, Department of Health, New Mexico Public Health Association. It does take all of us working together to make better places to live. So thank you. Go ahead, Wendy.
Okay, well, thank you. And I'm sharing my screen here because what we're going to talk about is what we're all going to be doing together. So this is a fact sheet that our Alliance staff put together for you that describes this really bold, brave new initiative that we are all going to be working on. I think it is very exciting. It's a game changer, and we're part of it. We're right in the middle of it. It is going to be a lot of work, but as we've been saying up to this moment in time, we're all in this together, and we've got lots of wonderful partners that are going to be working together and coordinating our efforts. So let me take you through this fact sheet. And at some point, if you have questions, how about if we hold the questions till the end and I'll run through this. So this is our program, the CDC Health Equity and Community Building Program. And our goal is to improve the health of all New Mexicans. Now, what it's going to do, first of all, for the health councils, what's in it for us, it is going to improve our capacity, our health council's capacity, to do the work that we've been mandated to do by the Department of Health, according to House Bill, the famous House Bill 137. But ultimately, what it's going to do is improve health equity in communities across the state. We're going to start with equity and access to COVID vaccinations and testing and all the other initiatives and efforts that we need to bring those rates down in New Mexico. And then once we get COVID under control, we're going to pivot and we're going to rebuild our communities after COVID to really ensure that everyone in our community has equal access to health care and to health outcomes, equitable outcomes. So who are our partners in this? We've got the Alliance and all of you who are the members of the Alliance, all of our health councils, the Center for Health Innovation, which is handling a lot of the paperwork. Thank you, CHI. And also NMCDC, Joni is here to tell us a little bit about the work they're going to be doing for the health councils in helping you get access to data that you need to have an effective response. The New Mexico Department of Health, thank you all for being here, all the many divisions. A special shout out though to our health promotion teams who've always been such a wonderful support to the health councils. And then of course to all of you, the tribal health councils, you're the one that are going to be doing the work on the ground, and we're all here to support you. So how's it organized? There's been some questions around this. The funding from CDC and Kellogg is going to the New Mexico Department of Health, and it is being allocated to two major components. The one here is the UNM Community Health Worker Initiative. This is going to put health workers in community organizations throughout the state. I understand that a number of health councils have applied for and are going to be having community health workers working with them. I think the initial cohort was 40 trained, and they are now going to be starting on the next cohort. So that's a community health worker initiative. Venice Caballo at, Ceballos at UNM is running that program. And then the other part is us. This is us, the Community Health Equity Rebuilding Initiative, CHI and NMAHC, and all of you participating health councils. We're going to be actually on the ground doing the work of building equitable response in our communities to, again, first vaccinations, and then following that to really rebuilding robust, healthy communities. I will pause in case there are any questions or comments, although I don't have access to the chat. So Sharon, maybe you can help me with that. Okay, so as I said, this is going to build a capacity for health councils to do the work that we've been mandated to do under HB 137, which is the County and Tribal Health Councils Act. So that establishes the comprehensive community health planning councils throughout the state who are endorsed by county leadership or tribal leadership to serve as the community entity that's going to convene, assess, plan, and implement health programs throughout our state that are going to accomplish this goal of healthy communities. So initially from this grant, all of you health councils, I think you already know this, that you're going to have support to hire staff so that you can develop your health equity committees to help with this, toward this goal. There's going to be capacity for you to self-assess where you are and to then get the supports that you need to achieve your goals in your community for health equity. Year one, unfortunately, we're going to have to continue to concentrate on access to vaccines, equitable access to vaccines, to testing, to all the other public health supports we need to bring this infection rate down in New Mexico. Then hopefully in year two, or maybe earlier, we'll be able to shift to really talking about rebuilding our communities beyond COVID. So you all will be doing your mandated, engaging in your mandated tasks, planning and assessment, including data collection, and this is where NMCDC is going to help us out. Collaborating with your leadership, convening and collaborating among your community leadership, mobilizing the community, defining your priorities, identifying what you need to accomplish those goals, including identifying and advocating for policies that are necessary for you to achieve your goals. So that's the kind of work we'll all be involved in together. We're going to have a lot of support in this, but again, you're on the ground, so we need to hear from you. You really need to take the lead in telling us what needs to be done in New Mexico. How can you get more information or become involved? Well, let me direct you to our Alliance website. Our Alliance, and let me go there now. Make sure are you following us? Still sharing the screen?
Yes. Yes.
Okay. This is our website, nmhealthcouncils.org. Here you will find a lot of information. The Alliance and our website and our newsletters and our announcements are going to serve as the communication infrastructure for this project so that we can know what you all are doing, because you're going to share with us what's happening in your communities, and we're going to post it here so that everybody else in New Mexico can hear what you're doing, what your challenges are, what your successes are, what you need to move forward. Move you over here. So just real quickly, this is our welcome page. We do have some really important news that we want you to be aware of right here on our page. We have a calendar of our upcoming events, and here you will find all those training and technical assistance opportunities that are open to councils, but to anybody else that is joining us in this effort. So take a look at our calendar of events here. Here's one of our trainings. Find out more about it. Need to move you back here. Whoops, need to get back. Okay. And then we have a little bit of information about us and how to get in contact with us. So let us know if you've got any messages for us. Fill this out, click the submit, send it us. We will be back to you right away. So real briefly, what's on our page? Don't get dizzy. I'm zooming up to the top here. We have information about health councils. So if you want to get in contact with one of our health councils, you can do that here. Find out about meeting times, look at their fact sheets, or find out about our public health regions. Tribal Connections is our new page. Thank you, Gerald and Antonia, for putting this together. This has information specifically to help us make better connections with our tribal communities. So we've got information on tribal sovereignty, on our pueblos. We have information specifically for our tribal health councils, supportive services, news and updates. Tribal connections. Programs, here you will find information about this program. So visit it early and often. Susie is going to be helping us keep this up to date, our program director for this project. So you will find information here that tells you more about the program. Will be adding information as it becomes available. So please visit this often and find out what the latest information is for this program. We have resources in case you have to find some resources to help you carry out your program. We are linked with the Share New Mexico Resource Directory. So if you have any questions on how to use that, let us know. We have some COVID updates here. We're trying to keep up with this because the terrain is changing daily. But right now, the message for COVID is it's not over. We still have to be vigilant. Our hospitals are overtaxed. Our medical professionals are getting very tired. The bottom line here is get vaccinated, wear your mask, social distance, stay home if you're sick, and get your boosters. So we need to work on this all together. This is going to take an effort, and thank you, Representative Terrazzo, for reminding us this is not a political issue. This is a New Mexican issue. We need to make New Mexico healthy again and open again. News and events, please send us your news. Here again, your successes, your challenges. We want to hear what's going on with you in the community. So that is how we're going to try to help keep you, how you're going to help us help you keep up to date with this initiative and what's happening throughout the state in our health equity and community rebuilding efforts. So I'll pause there briefly. I don't know if there are any questions at this point. No. Okay, I'm going to turn it back to you, John. But again, if you have any questions about this, please either go to our website and hit that contact us button, send us a message, and we'll get back to you right away. Thank you all for what you're doing.
Thank you, Wendy. I appreciate both you and Sharon. And there's a lot of, moving parts and pieces to this. And before we get going, I see that Christine Hollis does have her hand up. So before we move to the Health Council presentations, Christine?
Okay, I think I'm unmuted. No, just a quick point. And John, thank you very much for putting up the NMPHA site too, because they're also seen as a resource for all of us. And I just wanted to mention, I thought that was a great fact sheet or whatever that the Alliance has put together. One of the things though, in terms of the health councils is, I think it's also important for each one of us to understand that there are other programs out there that have been funded by the federal government and otherwise. For example, I'm kind of responsible in the Bernalillo County also, and I know there are at least 2 major programs there that are also working on the whole health equity and vaccine equity and everything else. So I think the more that the health councils might know of other programs that have been funded, some even funded for, health literacy components of this, which is a huge social determinant also for us to pay attention to. I think in terms of this whole collaboration partnership thing, it's best for us to know about those groups and try to connect with them, because I've actually found that some of them are doing things in a little more interesting fashion than the other ways of, being put down. And it's good to know that.
Yeah, no, you're exactly right. And so, I think, one of our components of the CDC vaccine equity funding is going to be forming a vaccine equity committee, or maybe you've already got a committee. We don't want to add another meeting to everybody's busy schedule. So whatever structure is going to work, right? We want to have those discussions and look at who's doing what, where, why, for how. I see Dr. Andazola joined me, just joined from the Doniana Wellness Institute. He has a great story about, being Las Cruces isn't that big, right? But if you have 3 diabetes events on one day, right? Like, why aren't we pooling our resources and working together? So I think the same can be applied to where we're at right now. And I want to definitely encourage you guys, as you're aware, talking with your health councils, and you're getting together and convening and find out who's got what funding to do what, right? Where is there potential duplication? Because there always is duplication. How can we collaborate? How can we partner? And so reach out to Leah Sanchez at NMPHA is on the website that I shared, the Vaccine Equity and Rebuild Network site. There's a section for programs and contacts. And what she's really interested in doing is connecting and putting who the contacts are and what the initiative is and for how long that funding is. And I know that's really, really important. So, so keep thinking that way. I love it. So without further ado, I really want this time to also showcase, and we can kind of see where our health councils are at across the Southwest region. And so we've got the presentations loaded, but if we need to, if you've already got them ready to go, we'll give you the power, or to have you just to share the screen. So kind of in the order that I kind of received stories from our health councils, I'm going to turn it over to Kathleen from the Catron County Health Council. Do you have your presentation up, or would you like us to click on the link? Kathleen, what can we do to help you? Oh, you're muted, Kathleen.
Yes, if you'd put it up, please.
All right, we can do that for you. And we're looking to have about 5 to 7 minutes, and then and we'll go through all the presentations, and then we can chat a little bit.
Okay, before I start, I want to introduce Shania Livingston Keller, who is our council secretary, as well as the coordinator for the CDC grant. She's also Hilda and my grandson's wife. Okay, the Catron County Health Council's mission is a community-based forum for assessment, promotion, and improvement of the health and well-being of county residents. Next slide. We were initiated in 1991 by the county manager to recruit and retain primary health care providers to the area and integrate public health and primary care services, as well as serving as an oversight committee for the Catron County Medical Center run by PMS Medical Services. In 2002, we revised our bylaws to become a comprehensive community health council for Catron County. We are composed of volunteer members from the county representing various agencies, programs, and interests. There are members from PMS, DWI, senior citizens, local business, schools, our sheriff, and the Village of Reserve. Annual events include a family health fair, teen health and career fair, a Halloween street fair, provider appreciation dinners, meet and greet for new providers, the sheriff, the superintendent, and candidate forums, etc. We are going to be able to have our family health fair again this year. Woohoo, after 2 years. Okay, next slide. We're a frontier county, the largest in the state, covering an area of 6,923.7 square miles with a population of 3,526, 0.5 persons per square mile. We have more elk than people in Catron County. The economy is severely depressed, and there's little industry. The traditional sources of income, ranching and lumber, have been eroded over the past few decades, with many people leaving the county to find work. Employment is primarily in the county government, the schools, and the U.S. Forest Service, with a few small businesses. There's a K-12 school in Reserve, K-12 in Quemado, and K-9 in Dattle, and no schools in the other towns. Next slide. Our survey results. Drugs were number 1 in drugs and illegal substances, were 55%, DWI 23%, property crime 12%, personal violence 10%. This survey was done in 14, but is probably about the same today, with an increase in number 1. Also, there is no provision for addressing number 4 in the county, and according to the YRRS, is a large concern. In 2000 and I think it was 13, our domestic unity was shut down because we didn't have enough people to count. So they took our funding away. But we still, percentage-wise, have a large number of domestic violence problems. Okay, the next slide. We're number 1 in state for meth and other substances, mostly fentanyl. We've had several recent overdose deaths in the county, and most of them, fentanyl was involved. We will be focusing on education of the citizens of Catron, doing Narcan trainings, and trying to reduce stigma. We'll be doing an assessment and finding ways to curb the high abuse. We work with DWI, the Catron County Medical Center, and others to get the information out. And we will be co-sponsoring a teen health fair again this year. Next slide. Next slide. Our access to care. There's no specialty care in Catron County. People have to drive 70 to 120 miles to the nearest specialist. Or like me, if I have to go to Albuquerque for a specialist, I have to drive 185 miles. The clinic offers primary care, a part-time dentist, and a behavioral health therapist, as well as telemedicine. We have no public health nurse, very limited access to hospice and home health care. 70 to 80% of the seniors live alone, leading to isolation and depression. We are a largely aging county. Food insecurity is 89% of adults, and 79.3% of children have fewer than 5 servings of fruits and vegetables a day. Oop, there's a typo. Next slide, please. Some highlights. We will again, after 2 years, have our family health fair, and we hope to have a teen health and career fair with both Quemado and Reserve participating together. We have obtained funding and support of various activities for educating children and adults. We collaborate and partner with the Catron County Citizens Group, the DWI, EMS Catron County Medical Center, the Village of Reserve, DOH, and other stakeholders in the county. Activities such as appreciation dinners for medical and emergency providers, meet and greet for new sheriff, superintendent, and medical provider, candidates forum, etc. We're now working on the CDC grant focusing on COVID for this year, as well as our other 2 grants, so we are busy. For more information or to attend our monthly meetings, contact me at 34 Mineral Creek Road, Glenwood. You see my email and my phone number. And that's it, unless you have some questions.
Thank you, Kathleen. That's it. That is a lot of work for a county with more elk than people. So thank you. It's always fun to attend your meetings.
And we also have our Hilda Keller, who's not only our president, but she's also the mayor of the Village of Reserve that is attending today.
Hi, Hilda. Good to see you. Thank you
Kathleen,
for
we had a
your-
question here. Could you repeat the date of the Family Health Fair?
It will be in April. We haven't set the date exactly, but it will be a Saturday, probably in the last part of April. But we will let everyone know. We'll put it on the Alliance website.
All right. Thank you, Kathleen. Next, I'm going to have Ursula Bo talk about the Otero County Health Council and what you guys have been up to. Do you need us to put your presentation up, or do you want to just share the screen?
No, I've got it on this end. I believe so. So I'm gonna go ahead and start with our OCCHC annual year in review video, and then I'll hop back on to do my presentation if that's good. Can everybody hear me good? Well, okay, awesome. Thanks, John. Okay. Okay, that was, yes, our annual year review video, just sharing some of the highlights we've had here from the Otero County Community Health Council. And then I'm just going to do just a little short presentation on some of the recent work and information that we have for OCCHC. And I'm gonna start with our updated mission statement and vision surrounding health equity work. And our mission revision is the OCCHC is to promote programs, practices, and policies that advance health equity in Otero. And our vision is the Otero County Community Health Council is for Otero County to be a place where all people have a fair and just opportunity to be as healthy as possible. And we not only wanted to revise the mission and vision to reflect the health equity work that we're focusing on, but also we're establishing a dedicated health equity committee, and we're continuing to work on that currently. Next, we have our HEAL action team, and HEAL is Healthy Eating, Active Living, and their focus is overall health. And their most recent project was their diabetes event, and that's still currently going on. Actually, the self-paced virtual walk is started November 14th through the 20th. Participants can enter a prize drawing and are encouraged to walk the Desert Critter Trail at Washington Park just for fresh air and exercise and overall wellness, and just encouraged to get out and walk. Yesterday, they had an on-site info table surrounding diabetes awareness from 3:30 to 4:30. That was also at the Washington Park. So they're doing great work as well. And then we also have our CARE action team, and CARE is community awareness, resiliency, and engagement. And they have two projects they're focusing on. The first is Gun Safety Project, where they would like to offer community members lock boxes, and the project is surrounding suicide and mental health awareness. And their second project is the Prescription Safety Project, and they would like to focus on prevention for children, friends, and loved ones from misusing prescription medications by securing them so those cannot be accessed, misused. Here, and then next up we have our Vote ER initiative that we've partnered with, and with this focus, we are trying to encourage our community members to exercise their right to vote, and then also have access and information to registration. If you'd like more information on that, you can go to the voteer.org website. And then our partnership with 100% Otero, they are an initiative that actively is working to ensure that all families and community members have access to 10 vital services. The first 5 surviving services: medical care, housing security programs, food security programs, behavioral health care, and transportation to services. And also the 5 thriving services: parent supports, early childhood learning, childcare, full resource, community-focused schools, youth mentors, and also job training. And they're committed to strengthening community members' health, safety, and resiliency. And so we're working alongside them to accomplish that mission in Otero. We also have our culture of health work, and we are collaborating with the Lincoln County Community Health Council along with Mescalero to continue to focus on policy change and advocacy surrounding CIT training throughout our region. And CIT stands for Crisis Intervention Team Training. So we had our latest success with that, and that was some members of Lincoln County and Mescalero first responder teams. They recently registered and completed their CIT training, so we're super excited about that. And CIT gives police officers more tools to do their job safely and effectively, and it also reduces arrest of people with mental illness while simultaneously increasing the likelihood that individuals will receive mental health services. And NAMI is listed there at the website for more information on CIT. And then we are also really excited this year. We got to prioritize again the recognition of our amazing OCCHC members, and some of our core team and some kind helpers were able to give out tokens of appreciation this year. to our members, just to let them know we appreciate their dedication and participation in our health council. And then I just have a little resource page here, and it's listed my email if you'd like to get on the contact list or get any further information about Otero County Community Health Council. And it's occhc.coordinator@gmail.com. And then also our Facebook page, which has our most recent information and events listed. And then our fact sheet is also listed on the sharenm.org website. So I appreciate everyone for your attention and interest in OCCHC. And that's the end of my presentation. I appreciate everyone for listening. You're muted.
You guys are blessed. I'm muted. So no, I just wanted to say thank you, Otero County Health Council. Great work. So I appreciate each of you. Let's move on to Socorro County. And is Sam still here, or is who's taking the lead again?
Sam had to step off. Sorry, I did see her say goodbye to us.
Okay, there's
Carrie.
Carrie. Yes,
Carrie.
Carrie.
Yeah.
Do you
Hi,
want us to
everyone.
share, or do you have it already? Do you want to have do you have the presentation up?
No, if you guys would share it, that would be great. And then I can chat a little after that.
Sounds good. We'll do that.
Sam's not here, but thank you to Sam for putting together that cute little video. It's got a little catchy beat. So My name is Carrie Paul, and I am the Vice President on the board for the Scope Health Council. So just to introduce myself, and then our mission with Scope is we will work together to provide a method for community health decision-making, to identify and prioritize health and safety needs, to establish and plan strategies for community health goals for the improvement of the health and quality of life in families and individuals of Socorro County. And of course, our vision is Socorro County, a safe and healthy community. So, sorry, I just kind of, I'm going through the list of things you asked for. So some of our priorities are capacity building. This year we've been pretty small up until now, and we have just been approved for a drug-free communities grant that's pretty significant, about $125,000 a year for 5 years. Here in Socorro, we'll be focusing on middle school curriculum for vaping and marijuana use, and trying to educate the teens about that before they get to high school and it's, big scary adult time. We've also gotten of course, we're doing the COVID community rebuilding. So our capacity in terms of funding has really gone up, and our focus in the next year or so will be, as an organization, capacity building to be able to have a second and third employee from Sam, who's been our contractor for a long time. So lots of exciting things happening there. Some of our other priorities are behavioral health, access to care, healthy eating, active living, of course, substance misuse and overdose prevention, and community empowerments. So as you could see from the video, we've been hitting a lot of those marks. Sam keeps us in line. So some of the things for teen and community mental health, we've been doing free mental health movies with free snacks at the Loma Theater here, which is, as many of you in small towns know, having a theater where we can watch movies and get together is really great for the community. There's been the Just Talk campaign that Sam's been taking to the schools, putting out there in the Stomp Out the Stigma 5K that we're in our second year of this year, where it's still going to be kind of a virtual race. Everyone does it on their own and submits their time. But Sam's worked with the local radio station, who's going to bring in mental health professionals and other, community members. We're going to have a whole kind of day of streaming. So as people are running their 5Ks, putting in their times, they can kind of keep an eye on that as well. As far as healthy eating, active living, as you saw, we've got the community garden here in Socorro. We've got the community garden up in Alamo that did amazing this year. We've got them super set up with the rain barrels and drip irrigation, all that sort of stuff. And then we're working with New Mexico Tech. They're wanting to have the students do a garden on campus there. So that's another exciting engagement for the community. We've also, as you saw, those cute chili bike racks. I love those. That was my bike with the cute little pannier bag. So I love seeing that picture every time she uses it for something. There's a lot of fun for the community. We had the biking day where we introduced them to the community. We partnered up with the farmers market. To do some of the other things we've done. We recently partnered with I always get the acronym, the Socorro County Prevention SPS. I'm sorry, someday I'm going to get that right. But we partnered up to do a candidate forum for the school board, which is really great. Again, as many of you in small communities know, it's probably hard to get information about who's running, what they really think. 2 questions in the newspaper isn't really that good, because it's our children on the line. So that was really cool to have that live streamed into everyone's house again. You could just watch it and listen to the candidates. That was really cool. And then of course, as far as the, substance misuse and overdose prevention. Sam's been doing lots of Narcan training with youth, with teachers, with other leaders in the community. We're gearing up for the drug-free communities. We've offered the position for that, a full-time position to help us out with that. So we're negotiating that and hope that our candidate accepts. She's a really great candidate. And that's really, I guess that's a lot of it. Are we taking questions?
We're gonna hold
Okay.
those, but great work. I mean, this is just, I
Yeah.
love the variety and the energy, and I say the small but mighty counties. Great work, Socorro
Yeah.
County. So thank you, Carrie.
Well, yes, thank you guys for having me and letting me step in for Sam. I'm not as eloquent, but
Oh,
I
you
get the
did
job
great.
done.
You did wonderful. You did wonderful. Thank you.
Thank you.
All right, so next on the agenda is that I have is Doña County, the Doña Wellness Institute. And we've got representatives, we've got Vanessa Gomez, who's our coordinator with us, and then we've got Dr. Andazola and Jamie Michaelwitz. So welcome and thank you guys for being here and all you guys do as well. And Vanessa, would you like us to share your presentation or do you have it ready to go? Do you want the share screen?
I think Dr. Andazola will be sharing it for our committee, representing our committee, if that's okay. But if you could share it, that would be wonderful.
We will
Sorry, I got
share
a
it.
party in the background here.
That's okay. We will share it and welcome Dr. Andazola.
Hi guys, go ahead and put that thing up. Wow, my voice sounds kind of, I don't know, interesting to me all of a sudden. So welcome everybody. I'd like to, first of all, say how incredible everybody's work is. I'm just really blown away by the initial presentations done so far on what's happening in the counties across New Mexico. And it's really right on line with the work that we're doing here in Doña Ana County. Real briefly, before we move forward, I just wanted to tell you kind of who we are and how we focus and where we're looking. I think Doña Ana County is lucky in the fact that we have a lot of incredible people. We have like the university right there, and there's a lot of incredible people that we can tap and learn from. And I think our main focus in Doña Ana County is really an upstream focus. And so I'm going to try to look at as many people as I can. So I'm going to open this up here. So I can see most of you guys. Now, can you guys put your hands up if you know what upstream focus is real quick? Just real quick. You guys are awesome. So that's incredible. So I'm the program director of a residency program, and I teach residents in family medicine. And I bring in medical students and I bring in pharmacy residents and all of that. And I ask that question, and a small percentage raise their hand. It's crazy, right? So these people are going into medicine, and in a small percentage really understand what the upstream focus is. So what I'm going to do is tell you a really quick story, and then I'm going to run through my slides and let you guys have time to ask questions. But the story I tell is my metformin story. I'm going to have to tell it. And so what this means is, like, I'm a doctor. So I have a patient comes to me and she has new onset diabetes, right? And so I'm really good. So yeah, write for her the right medication. I put her on metformin. I give her information about diet and exercise. I send her to a diabetic educator, and she comes back to see me in a month, and she's not changed her diet, and she's not exercising, and she hasn't taken her medication. And so the cool thing is I have a psychologist. We have integrated behavioral health in our clinic. And the psychologist is like, John, that's behavioral change. He said, pamphlets don't change behavior. Lectures don't change behavior. He says, you got to do motivational interviewing. Let's talk. Let's get the ball rolling, and let's work together. And let me help you get in there with the patient. So he helps me get in there with the patient, and we talk and we learn and we figure out those barriers and do behavioral change models. And next thing I know, she's taking her pills and she's there with me, and her sugars are looking much better. But I ask her, how come you haven't changed your diet, or what's going on with the exercise? And she says, well, I live in a colonia. I live in an unincorporated community here along the US-Mexico border, and I don't have sidewalks. And the nearest grocery store that has fresh fruits and vegetables is an hour away. And so, you know, when I say, when you get home from work, just walk around the block. She's like, no, I don't have streetlights. There's a lot of dogs. I can't do that, right? And so that's the next level, right? That's the social determinants of health we talk about. It's the structures that cause health. It's health happens where a person lives, works, and plays. It doesn't happen in the clinic. It doesn't happen in the hospital. It happens in the community. And so how do we address those? And so that's the next level that we talk about with our organization. And so it's bigger, right? Those are policy issues. And I got super excited when I hear about put out the vote, because you guys are working upstream. You know, those are the right things to do. Talking to the legislators, building infrastructures like putting bike racks and trails and sidewalks and making those readily available. Those are the things that help health. And I'm super excited to see that happening statewide. So I'm going to go through my slides real quickly. So that's the Doña Ana Calnas Institute. Can I have the next slide? So our mission is really to collaboratively create a community-centered integrated health system to improve the health of Doña Ana County residents. And our vision is that all Doña Ana County residents live in a physical, cultural, and social environment that supports their health from cradle to grave. So the environment keeps them healthy. Next slide. Our values. We believe that healthcare is a common good. We believe that communities thrive when people have access to health, high quality, cost-effective care, effective healthcare, integrated primary, behavioral, and oral healthcare is our key components of that. Upstream factors that I talked about are including the social determinants of health have the most profound impacts in health. And so we really want to do that. We want to make the biggest impact in our community as possible. And then robust healthcare systems are built on solid evidence and supported by sound data and policies. So we're not just going to jump into a model. We're going to critically appraise that model and think about what model best helps our community. Next. So this is our purpose. We convene, we bring together the stakeholders, we transform, we teach, we share, and research. Next slide. So our convening is really bringing together stakeholders, and I heard you guys are doing the same thing. It's not just the health stakeholders, you know, it's other components that impact health. So it's our schools, it's our grocery stores, it's our banks, it's our policymakers. And so all of those people come together in our institute to talk about health. We work to work and develop and test value-based integrated healthcare systems. And believe it or not, we work with some of the payers to help think about how we can best structure our response. We teach. So I'm a trainer of family physicians. And so we directly train healthcare professionals of the future to understand this model and to know that if they want to be effective, they have to understand what's happening in their communities and they have to take action in their communities. And then we also extend this beyond our healthcare providers, our nurses, our health professionals. We extend this into the community and to leaders, because the leaders need to know this. Policymakers need to know this, because when a leader makes a policy, that impacts health. And we go by the framework of health in all policies. So when a policy is made, what is the impact of health and how does that work? And we work with our policymakers to do that. We share and we help communities develop their capacity to address their healthcare needs, and we ask them what their healthcare needs and involve them with that. And then we work closely with others to gather and analyze the research to drive us in the right direction. Next slide. All right. So this is some of what we are doing. The Wellness Institute is currently working together with New Mexico State University to develop a structural competency certificate program that is set to be available in the spring. So what is this structural competency stuff? So like I was talking about, it's where you live, work, and play. It's the structures around that. It's the policies around that, right? So a person lives in a certain neighborhood and has certain issues of that neighborhood because of the policies and structures that led that neighborhood to be that way. And so how do you dismantle that, right? How do you fix that? And so you develop structural competency. You learn how to impact on those structures. And so the first level is individual, how I myself interact. And that's like dealing with implicit bias and learning how to deal with our biases and the things that impact how we interact with each other's. The next one is interpersonal. How do we work with each other? The next level is institutional. So how does your clinic, how does your institute, how does your business impact the health of others? And then the next one is policy, and it's inviting the policymakers to the table and talking to them about policy changes. And then last one is research, is looking at the interventions and changing that. And so there's a lot of research on this, and we are working with New Mexico State to put together this structural competency certificate program. And it's going to be online. It's completely free. And we want, we invite really all people in our communities to take that, but really focusing on the policymakers, the leaders, and the health councils to dig deep into that, to become experts in this, so we can make all of our communities healthy as we can. All right, I put the pictures up to see you guys, and now I have to go back to see my bullet points. All right, next we've joined with other organizations focused on opioid overdose and prevention, and we provide a place for these groups to coordinate and share. So John mentioned this earlier. Part of the reason this council was created was when I came to Las Cruces, and I'm born and raised in Las Cruces, but I spent many years away. When I came back home, I went to the mall, and the mall was having a diabetes health fair from the nursing school. Then I went to a park, and there one of the federally qualified health centers was having a diabetes fair. And then I went to the farmers market, and another organization was having a diabetes fair. And I was like, wow, it'd be really cool if we all like worked together. Well, I noticed the same thing with opiate interventions, and there was a ton of different opiate interventions occurring in our community, and we brought them together around the table, and everybody keeps working together, but this way we can synergize and have a better outcome. And so we don't compete with each other, we work together. And so we created Opiate 360, and it's an offshoot of our council where all the organizations working to fight opioids are together and working together to move us in the right direction. We've joined forces with those organizations that are doing COVID work. We've done the same thing. We implemented a COVID to home program, and we actually have been starting to work on vaccine equity in our community, and really bringing together various stakeholders in the organization to tackle our issues. And lastly, we're partnering with NMSU to create a health equity postdoctorate position. And I think this is awesome, to help lead us in a positive direction. So we're bringing in a doctorate level individual, working with NMSU to partner with the salary of this individual to help guide our council and help continue to move us forward to those next steps and to address the upstream issues that impact our community. I think that's my last slide. Is that my last slide?
Yes, looks like it.
All right. Thank you, guys. I talked really fast, but I wanted to give you a big picture and not take up too much time for respect for all the great work you guys are doing. Thank you, John.
Thank you, Dr. Andazola. So we've got two more, and then want to kind of open it up and see if there's any questions. Edith, Lee, Luna County, you guys have not been busy at all. I know that. And I know I'm not being honest here. You guys have been, everybody's been extremely busy. So do you want us to share your slides, or you want the share screen?
I can go ahead and share screen.
Perfect. Thank you, Edith.
Hope you can see it right now. Okay. So good morning, everyone. My name is Edith Vasquez. I oversee the Luna County Health Council, and I'm going to go ahead and move this because it's blocking my view, and I don't know what I'm going to be presenting if I'm not seeing it correct. So So our mission is to build on community strengths by possibly addressing the needs through collaboration of consumers and agencies, thereby increase wellness of families.
Edith, your presentation went away. I see.
It
your
went
video.
away.
Yeah,
Okay.
I see your, I like your screensaver, your background.
It's really nice. Well, thank you for letting me know. I'm gonna have to move my computer because I'm working with 3 screens, so it's hard to do that sometimes.
Wow, Edith, you're taking multitasking to a new level with 3 screens.
Can you see it now?
Yes, looks great. Thank you.
Awesome. Okay. So something about the Luna County Health Council, we are dedicated to improve the health and wellness of women, children, and families residing in the county. It is open to anyone that has the same concept to promote health. Some of the issues that we have seen here in Luna County, and this is one of our main priorities, is to reduce substance use. So with substance use, we started about a year and a half with reducing prescription drug misuse among 12 and 15-year-olds. We noticed last year that actually our numbers went a little bit up. So 17.5% of youth misuse prescription medication. And unfortunately, Luna County had the highest prevalence of painkiller use to get high in the YRS data. So due to this, we decided to see what other options we can do to address some of the issues we're dealing in our community. We provided some presentations to parents with Help Me Mexico and the Children's Museum here in Luna County. We collaborated with the CATS, Coalition Against Teen Substances, to provide this presentation. People that attended those presentations, we raffled some lock boxes. That way they can keep the medication safe. We created social media messages just to inform our residents regarding some of the facts, and definitely educating parents. That was one of our main goals. We had some partnerships here in the community with some funding that the Health Council received. We were able to disseminate flyers, handbooks, pocket guides to different places here in Luna County. We collaborated with law enforcement during the National Drug Take Back event in Columbus. It was a great event. We collected quite a few medication from people. Some people were just stopping by to see what we were doing. Some other people were very grateful that we were there because there's not that many services in Columbus. So with our opiate prevention work that we're doing, so we wanted to know what the community knew about opiates, some of the harm reduction services that the county has. A lot of people were not informed. So with one of our CHWs, we decided to create just some this survey just to distribute in the community. We interview our chief of police, our county manager, different stakeholders here to know what they knew about the services, some of the issues they have seen. Our law enforcement was a key for us to continue with this work. And this is some of the results that we got. Not enough substance use treatment providers in Luna County. More behavioral health services are needed. Education definitely is needed. Our need to distribute Narcan, law enforcement reported there was during the pandemic, the drug overdoses increased and the need of Narcan definitely was there. We need to promote more about the harm reduction services that Luna County has. So as a result of these, the answers that we got, we were able to do some changes in our prevention education. So we decided to do this, to create these materials to distribute it within our community. So we wanted to make sure that we were promoted to take the medication as directed to lock medication, especially if you have kids or grandkids. It's very common in our community that grandparents are raising their grandkids. So we wanted to make sure we provide that information to them. not to share medication. I know it's difficult and it's something that we want to make sure that we educate our community, dispose medication safely. That's another another key component of this campaign. And get Narcan, get Narcan and save lives. We were able to do like a car size about the harm reduction program in Luna County and distribute that as well. Those are some of the lock boxes that we distribute. We distribute, I want to say, about 30 lock boxes throughout the community. So another health priority that we have is about reducing youth access to alcohol. And right now, Luna County is 31.6% of high school students reported current drinking. But like you can see throughout the work in the last 10 years, we have done wonderful work. We were the highest prevalence in underage drinking in the state. And right now we are the 7th highest. So we have done a lot of work and you can see the results of that hard work. So this is some of the environmental strategies that we use. We started with our DWA program with a Not in My House, trying to educate parents, engage the community as a whole to make sure that we change the norm in our community, make sure that parents are not hosting underage drinking parties. Throughout the work with the Health Council, we had a social host ordinance passed. And that was one of the keys to start this kind of education, to make sure parents are we know that parents are the #1 reason why kids don't drink. So provide those tools for parents to make the decision. I think it's the key on reducing underage drinking. So throughout the pandemic, we noticed a few things with the RDWI program reported. One of those things was that we were getting DWIs with underage people. So we asked where are they getting their alcohol, and they were going and buying their own alcohol. So we working on this strategy, the Responsible Beverage Service Strategy, RBS, and our intern actually helped creating some of these materials. So we're doing buttons for servers. We're going to be visiting alcohol outlets and making sure that we want to offer that we there for them to make a good choice and not selling to minors and intoxicated people. So we have this is some of the information that we're going to be distributing. Actually, Monday, we're going to be going out and doing these bags. We have bags for each server with some promotional items and some of the information for them to make a good decision. So this is some of the information that we are working on. I know that I wanted to be very brief, otherwise I would be taking a lot of time. We're working in other different areas with baked bean. It's something that we noticed that Luna County does not have a smoking cessation program. So we're looking into bringing something to Luna County about smoking cessation to reduce some of the tobacco issues that we have. Thank you so much for your time.
Thank you, Edith. Great presentation and great work by the Luna County Health Council. One more, thank you guys for bearing with, and our agenda got a little bit off, but I want to give Grant County the opportunity to present, and I want to respect everybody's time too and make sure that we're out of here by 12 because I know we've got places to go. Evangeline, I see you're unmuted. Do you need us to click on what you want us to click on, or do you want to take over the sharing?
No, we need your help. And Marilyn Alcorn, who's with us somewhere. I see her right there.
I see Marilyn, yes, and then the Hollywood Square.
Yeah. So anyway, Marilyn is our chair. So she's going to begin our presentation. If you'll help us with that. So thank you, everyone. Good to see everybody.
Yeah, if you would put our organizational diagram up on the screen. Wanted to kind of just start there, and then we'll share some of our stuff that we're recently doing.
Awesome. Thank you, Marilyn.
Okay, so this is our organizational diagram, and I kind of wanted to give a brief story of how we have reorganized since the beginning of this year. And if you look there, you can see our emerging infectious disease COVID-19 task force that's off to the side on the left. Our task force actually was started by a concerned citizen in our community with the request and encouragement of one of our county commissioners. This person began organizing community leaders using a collective impact model. At the time, our county commissioner didn't even realize that we still had an active health council, which at that time only had 4 members, myself, Evangeline, Priscilla Lucero, and Terry Anderson, who had been in the original larger health council back in the time. Our community response, well, the reason that occurred is because we no longer had a paid coordinator. So the 4 of us kind of held on, I would say, by our fingernails, trying to keep us alive until something changed on the financial front. The community response that we are going to give you an example of some of our recent work happened not because the Health Council had the capacity or staffing to initiate it, but because the Health Council stumbled onto the effort and then took an active role in supporting, participating, reorganizing, and taking the COVID task force in under the Health Council umbrella, giving it the needed official recognition needed through HB 137 as an extension of the official Health Council. We then proceeded to concurrently reorganize ourselves by inviting and engaging members from our collaborative community partners who were participating in the COVID task force to join our newly restructured Health Council. COVID actually provided the mechanism by which to jumpstart the Health Council back into life. Using some of our limited remaining funds, we hired a consultant to provide strategic planning assistance on how to move forward in reorganizing ourselves based on our experience in participating with and adopting the COVID task force under the Health Council. Our current Health Council structure is a result of that association and experience. The Health Council should have been financially and sustainably positioned as the entity who should have initiated this pandemic response. Sadly, we were not, but our community was lucky we had a concerned citizen with the background, skills, and ability to get the effort off the ground. Not every community is necessarily going to be so lucky. And for a time from January to June of this year, we had a part-time paid coordinator we were able to subcontract with through CHI. Once that contract ended, however, we have been without, again, a coordinator from July 1st until even this moment in time. We just kind of held the task force together. We downscaled. We had been meeting weekly throughout the year. We downscaled to once a month, and we've actually had to pick up a little bit more of the pace once again because of this collaboration where we brought all of these different groups, community groups, into the steering committee. We caught wind that our SkyWest Media here had been talking to the town of Silver to do some messaging because of our uptick in numbers here in Grant County. And so we jumped in the Health Council and got into the mix and collaborated with the county, the town, Silver Consolidated Schools, WNMU, GRMC, in pulling together some money to put out a media campaign for the month of November and December. And if you would put up that video clip, please. This is the current messaging video we have going for the next couple of months that was done collaboratively with a lot of our partners who are our trusted voices source.
Grant County is making national news, but not in a good way. Did you know that right now Grant County is ranked very high in the country for the spread of COVID-19?
That's right. We have more people testing positive for COVID per capita in our area than any time previously during this pandemic.
Grant County residents, we need your help once again to help reduce the spread of the COVID-19 virus in our community. First and foremost, please remember, if you are going to be out and about in the community, always wear a mask. Socially distance from one another 3 to 6 feet whenever possible. And always, when you get a chance, wash your hands. Also, avoid large crowds or areas indoors where masking is not taking place. Finally, if you're not feeling well or someone in your household is not feeling well and symptomatic of the virus, stay home. Do not go to school and do not go to work if you're sick.
We encourage you to get vaccinated, and if you're eligible for a booster, get one. Visit the New Mexico Department of Health website to register.
If you feel you have COVID, get tested. Once you have tested, stay home until you know the results.
Some testing locations include WNMU's Watts Hall and the HMS Silver City COVID Clinic. Knowing if you have COVID, even if you're not really sick, can make all the difference in stopping the spread of COVID.
If you or a member of your family are positive for COVID-19, we want you to quarantine and contact your medical practitioner. We're here for you.
If you have COVID-19 or think you have COVID-19 and have shortness of breath or are just not getting better, Gila Regional Medical Center is here for you.
Grant County, let's do this together so we can stay together and stay open. All of us can do our part and make a difference.
Thanks. And then would you also put up the audio clip? We have the video going on social media. We also have a lot of radio spots. The one we're going to highlight is just from an elementary school student. We wanted to involve it down into that level. And so this is one that the Health Council put together. Uh-oh.
Okay, so it looks like I'll have to download this version. I can do
And
it.
if you can give me screen share, I might be able to do it. I did download it and hopefully it'll run. Hopefully, no guarantees.
I have access to share screen right now.
Okay. So let's see if this is it right here. Oh, hopefully that, nope, that's the video. Don't want that. Okay, let's see what happened to the audio clip. Maybe I don't have it. If you can try to figure that out on your end, I'll share this. I just received this
Marilyn,
morning.
I could share it now. I'm sorry. I got it.
Okay, that's great. Good. Go for it.
Okay.
The Grant County Community Health Council urges all vaccinated residents to encourage their unvaccinated family, friends, and colleagues to get vaccinated to help stop the spread of COVID-19 in our community. Parents, please get your children 5 and older vaccinated. Remember, continue to mask, especially when indoors and in large gatherings. Let's work together to stop COVID in its tracks and help us all return to the activities we love and miss.
And then if I can have the screen share, I just received this newspaper ad that's going out into our daily press today, so I didn't have it yesterday to hand over to you guys.
You should be able to access that, Marilyn.
And here it is. This is going to be in the newspaper. It's kind of the if-then type of thing. It was felt that people still are unsure what they should be doing when they have tested positive or are awaiting to see if they are positive from a possible exposure. So this was going to be out in our newspaper. And just to mention, I think I caught wind of this talk that was happening between SkyWest Media and the town on a Tuesday. By Wednesday, we had gotten together, had a conversation with a lot of the players, pulled in some others that hadn't been considered, looking at pulling together monies towards this media campaign. By Thursday of that week, we had everybody together in a meeting to flesh out what it would look like. And by the following Monday, we had production of that video happening. And it's basically radio spots were being shuttled in by individuals that were in that meeting and already up on the radio by the end of that week when we had the meeting on Thursday. So what happened, even though the Health Council didn't materially have the money to do this whole promotion, we did use a little bit of budget to kick in to increase the number of radio spots. And we were positioned because of the COVID task force experience and then our new reorganization into our different networks, get together with partners, bring them into the pictures, get them at the table, and get this media campaign up and rolling, and still without a coordinator to this day. So I guess that's pretty much what I had to share. Evangeline, you have anything you want to step in?
No, you pretty much said it all. I think the collaboration, which is part of our mission statement, is showing itself in the example that Marilyn used. And and this afternoon, in fact, we're having a meeting with our steering committee where we're going to share even more information. So I think you've said it pretty well. Thank you.
Okay, I guess
impressive.
You can go ahead and take the screen back. Or do I have to give it back to you?
I think you have to give it back.
Yes, you'll press stop share at the bottom, Marilyn.
Okay, if I can get there. This is not my forte, I will say, in managing this stuff. Stop video, stop. Share. How do I give it back?
Marilyn, it might be at the top of your screen. Check the top.
There, stop share. Found it. Yeah, it kind of moves around there.
Awesome. No, great work, Grant County, and thank you, Marilyn and Evangeline for sharing. And yes, we're down a health promotion specialist who retired after 26 years in Grant County. Huge loss. Yeah, staffing is one of the big, during, well, anytime, but especially now with everything going on. So it is 11:49, and you know, I had I think an ambitious goal, but didn't know that we'd have a special guest in Representative Terrazas. So I thank everyone for their patience and flexibility and adaptability. That's what we do, right, in public health and in healthcare. So with the last 10 minutes, I just real quickly wanted to have Dr. Joan Appel real quick talk briefly about a really exciting piece. And I think this helps us put it together as well and go back to maybe some of Representative Terrazas's comments, right? It's all about data and information. Where are we targeting our efforts? And the team at CHI, at the New Mexico Data Collaborative, is working tirelessly on helping us understand a little bit better that data, our county profiles, the social vulnerability index that is huge. And it goes to what Dr. Andazola was talking about structural competency and the social determinants of health. So, and I think this will be a great way to put it all together. And then I don't know if Travis Leva is still with us and Angie Corral, but I'd like them to real quickly after Joan talks, just quickly talk about what DOH is doing around community health workers. And I'm going to turn it over to you, Joan.
Thank you, John. So we've been working on the dashboards because we want to get you guys data dashboards and community health profiles by the end of December. So we have one to premiere today. We have a finished example from Catron County. So I'm going to go ahead and share screen and just kind of give you guys an example of what we've been putting together for you to access your data. So this is what we have for the first section. We have different sections here at the top. We have a section for COVID. This is where you're going to find COVID data related to your community. Some of the data is county level. We do have some sub-county level data. What we have here is vaccine hesitancy, and this is at a sub-county level. It's up here in the upper left of your screen. And we have different numbers based on basically it's nationally identified numbers. So if they're a little bit different than DOH does a lot of quality control. So, but these should be close. And they have a lot of different breakdowns here because I know you guys want to compare this information to some things like the social determinants in your region. So we have some vaccine hesitancy data here. You can click on different tabs here at the bottom of a lot of the maps too. You can click over here. We have cases versus deaths, and this is county level data. If you're ever wondering what this specific information is, go ahead and click on the county, click on the region that you're exploring. It'll pop up here with some information and it'll tell you some numbers. And these will be helpful when you're comparing different communities. We do some numbers based on population because, as you know, a population that has a small number of residents, it means different to see a certain number of cases in that community than it does in a larger community. So we have, again, John was talking about the social vulnerability index, and we've been trying to do things like compare the county cases versus the social vulnerability index. You can find data like that here. We're also going to be doing a little bit more in-depth explanation of these dashboards coming up in one of the Alliance meetings that you will be attending in December. So this is just kind of a premiere sample of what we've been doing. Here we have chronic disease. Of course, this affects COVID and how you respond to COVID and different life expectancy numbers. And this is not the only tab we have. This is relevant for your vaccine equity reports that you're putting together, but this is the Vaccine Equity Project. We've been working hard trying to develop which indicators would help you when you try to take a look at equity in your community. So we have an extensive collection of data here. When you click equity and priorities, what we've done is we've taken your published priorities for your health councils and we've put them here in different tabs. And we made sure that the ones that you identified most recently as most important for your community are included here in the different sections. So for equity, we've got everything from income equality, food, nutrition, and health, housing equity, early childhood, access to services, built environment, community safety, environment, mental and behavioral health. We tried to be really comprehensive to make sure we were giving you the best data that we had available. A lot of these, they will have different maps, different graphs and pie charts that'll explain some of the information. Some of the information we didn't have maps for. We didn't have detailed enough information, but we posted what we had. We have some numbers here. We even tried to break things down by different demographics, because as you know, equity is not just one thing. There's so many different categories you need to look at to really look at equity as a whole. So you can go ahead and click on these different tabs and explore. We have lots of resources here. You click on the points and you can see things like food banks here and pantries, different places where there's fast food versus farmers markets. So there's a lot of information here to explore. We've also included a recovery tab here. We want to look forward to the future. We know a lot of things COVID did exacerbate, but we want to look forward. Number one, we want to look at the protective factors in our community. We have different surveys that look at protective factors. So we have this displayed here. And unfortunately, some things were exacerbated during the pandemic, and we do want to track those as we try to recover from what has happened during this pandemic time. So we have things like information on domestic violence, we've got substance abuse, mental health, overdose, and just different occupations and who's basically employed, what kind of industries they're in. And in the coming weeks, months, and especially next year, we're going to be teaching the health councils how to navigate, not only navigate this data, but hopefully how to update it for your community moving forward so we can keep this current and keep this as a useful resource for all of you. We also like to include something we call local updates. This is a place where we get to embed your local website here. We want to make sure we connect back to you, the ones who are doing the work on the ground in the health councils. And we want to make sure that people know how to navigate back to you in all of your efforts. So we do have this website embedded here that will be relevant to your local community. So I'm going to pause. We have a couple minutes. If there's any questions, go ahead and please articulate. Again, we will be having a more in-depth session. This is just a snapshot to let you guys know what we've been doing and maybe help you formulate some questions early on. Thank you.
Joan, this is excellent. You know, and I think this is going to be extremely helpful as we move forward and put all the pieces together. So I appreciate it. Travis Leyva is with us, but I believe he's still with us. Are you still with us, Travis? He may have had to drop off, and all I wanted to say is another great partnership that I wanted to share with you guys real quick is that you know, as we're looking to expand community health workforce and community health workers across the state, couple things. Doñana County Health and Human Services, I wanted to report some exciting news. It's received a nice sized grant from CDC to look at workforce and how do we expand and develop CHWs in traditional settings, but also non-traditional settings. So look for more to come with that. And what I was going to talk real briefly, or have Travis talk about, is our CHWs. We're putting them in our local health offices and integrating them in all of our public health offices in the Southwest region. So I wanted to make sure that you guys were aware of that. It's going to be really exciting because they're going to partner with our health promotion team, be under the supervision of our nurse managers, and be out in the community and not only focusing on COVID activities, but we know that healthcare needs may or may not have been addressed, most likely weren't addressed during the pandemic. Knowing that our population, we need to make sure that, you know, we're offering women's health care, pap smears, and then sometimes we get results, right? And we're not able to track down the patient to give him or her the result or him the result, right? So our CHWs are going to help in that piece. So just wanted to throw that out there as another kind of excitement. And I think, you know, there's a lot of negativity around the pandemic, and I wanted to kind of end on that, right? Where it's, don't turn on the news or limit your time on news and social media, right? There's a lot out there, a lot of noise. But there's a lot of positive work. There's a lot of we're rethinking how we rebuild our public health infrastructure. And, you know, I want to end on, you know, and thank each and every one of you for the work that you do. I want to thank our partners, the New Mexico Alliance of Health Councils. And you know, there's more to come, but we're all in this together. And I just am, you know, I pinch myself every time that I have the opportunity to work with all of you, and look forward to doing more work. I want us all to stay connected, be connected. No questions are out of bounds. So please reach out to me, reach out to your health promotion team, reach out to Sharon and her amazing team at the Alliance of Health Councils. Go to the Alliance website. If you don't know how to connect, we can help you guys connect. Health equity is also about connecting and sharing resources. So with that, go forth and conquer. Have a great lunch. Be well. And thank you all again for your participation and sharing today.
Bye, everybody.
Bye, everyone.
Thank you all.
Thank you.
Thank you, Wendy. Thank you, Geraldine.
Good job. Thank you, Wendy and John and
Oh, and
Jeremy.
thank you, Maureen, for kicking in there.
Oh, sure, no problem. Super easy.
Wendy,
John-
can you end the recording?
Yes, and do you want, oh, sorry, yeah. In the recording.